children. We've learned how to protect them against many of the threats from the past. Advances in medical science have all but erased the fear of many childhood illnesses. Yet still today, few words strike as much fear into the hearts of parents as a doctor saying, "Your child has cancer."
When Adrian started to feel bad, everything started with stomach aches. The colonoscopy showed up that it may look like leukemia. I was at work when they gave me the news. It was really tough. I thought my whole world was falling apart.
Each year in the United States, more than 13,000 children are diagnosed with cancer, and more than 40,000 are in treatment fighting the battle of their lives. Billions of dollars are rightly spent each year to prevent and better treat childhood cancer. But one underutilized tool promises to dramatically improve the lives of children as well as their families in their greatest time of need. For decades, there have been tantalizing stories about the power of animals to bring comfort and help the healing of sick children. But with little hard science, rigorous data, and concrete evidence of the kind necessary to gain wider usage of this promising therapy, the stories were just that, stories.
LaVie and I have been visiting St. Joe's Hospital for 9.5 years. LaVie is a therapy dog in animal-assisted interactions. I enjoy meeting with kids and having dogs and see what a dog can bring out of a child. When visiting kids, we're always trying to find anything to make them happy for the day. Dogs just have a sense about things that I'm not sure we'll ever totally understand, but it is a gift, I believe, from them. I think we need to learn more from them about what they have to offer for us. And I think once we do this more and get more and more research behind this, this is when we're going to really find out the results and how incredible it can be.
In 2010, American Humane Association, which has been a pioneer in animal-assisted therapy, launched a major effort to scientifically document the benefits of using animals in some of the most critical moments of human life. With the support of generous funding from Zoetis and the Pfizer Foundation, American Humane Association began a wide-ranging research project, the Canines and Childhood Cancer Study, to examine how this accessible and affordable treatment improves the wellness and quality of life for children with cancer, their families, and the therapy dogs themselves.
The therapy dog participated with Adrian. His name was Chaco. He was just a sweetheart, a baby.
Before he came to visit, I was depressed and I didn't really have much to do. He would lick me a lot of times, especially on the face, and he would also catch a ball when I threw it, and I also was able to walk with him one time, and it just made me happier for the rest of the day. For once in the hospital, I didn't feel like I was at the hospital. I just felt like I was at home playing with a dog.
The reported benefits of animal therapy include decreased stress, improved social skills, physical exercise, and decreased loneliness and depression. To prove this, researchers created a 3-stage scientific study consisting of a comprehensive literature review, a 6-month pilot study, and a full clinical trial, which is now underway at 5 children's hospitals. Through their work, researchers are exploring how young patients experience less harmful stress and have an improved quality of life throughout their treatment.
It was Christmas of 2007. Mom said, "Did you visit my son in a room?" And I said, "No." So we went back. LA was very tired, so I didn't expect him to do much, but yet he jumped up on the bed. Come to find out, little Johnny was paralyzed on one side. Well, before we knew it, little Johnny was attempting to move. Dad was crying, Mom was crying, and yet the doctors and the nurses did not have what it took to try to get Johnny to move. Yet LA gets up on a bed and he then brings it out of a little guy to have him at least start attempting to, move the arms that he needed to move.
But the study is also looking at the benefits to the entire family, which is affected as much as the child, and will also examine how the animals respond as well. Early data show that the therapy dog's stress hormone levels were lower after sessions with the children, indicating that the animals themselves were not distressed by the experience. Animal-assisted therapy appears especially promising as a tool in helping to deal with the effects and impact of cancer. Cancer is a disease that has far-reaching impact on not just the child, but all members of the family.
I really think the story is so untold that I think we're going to find some incredible answers out there, mostly to see that a dog can do things, again, that the doctors and medicine and nurses just can't do.
I believe the study is important because it will give facts and data that is really working for the kids and their benefit.
I would like that other kids get a chance to play with dogs. I think it would make them feel better because it could distract their mind off of cancer and let them have fun.
The power of animals to improve and even save our lives has long been known. It's a story as old as humanity itself. As we work to show with science what we already suspect in our hearts, the use of this underutilized and uniquely helpful tool in the war on childhood cancer may begin to be more broadly used in our hospitals and healthcare system, bringing new hope to those who need it most.